The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Welcome to our weekly update webinar. This is Rebecca with WFIA. As always, I'm going to keep everyone muted on listen-only mode until we get to the point of the call where we can take questions. So please be sure to mute yourself on your end so that when we do open it up for questions, we're not getting a lot of background noise. You can also use the questions panel on the side of your screen to ask questions, or click the little hand raise button so that we know that you want to talk. And with that, I'm going to give it over to Tammy. It looks like Tammy might be having some audio trouble, so bear with us just a second while we work that out.
Okay, good afternoon. So thank you for your patience while we get everything up and running here. So today we have an announcement from the governor's office that we have a statewide order that now all businesses are required to enforce the use of face coverings by all customers or clients. So what this means is that we've got some changes. This was in effect in Yakima, and so they've been experiencing this. We do have guidance, and we have best practices that we've received from the governor's office, which we sent out to everyone, and it's posted for you on your screen right now. We also today have someone from the Department of Labor and Industries to give us some more insight on this and to help us kind of with guidance. So today we have Brian Solly, who is a DOSH consultation manager for the Department of Labor and Industries. So his team is the one that will be out there enforcing and making sure that we've got everything in place. So I want to give him an opportunity to talk on this. He and I spoke earlier today, and I've explained a little about what we're doing, the guidance that we've been given, and you know that as long as our employers are making a good effort to try to get people to wear a mask, they should be fine. So with that, Brian, I want to say thank you so much for taking time to meet with us today, and I will turn it over to you.
You're welcome. So as you all probably know, the governor's order went into effect today, July 7th, to have everyone in a public facility or building in the public, anywhere outside, inside, need to wear a mask. And the Department of Labor and Industries has been charged with doing some enforcement on that. Our primary goal is to educate and to get compliance through getting the word out to everybody that there is a governor order, that it is a requirement, and that if people take a good faith effort, make a good faith effort to put up signage, to have all their employees wearing the mask, to let the public know that they should be wearing those masks, that it is a requirement, then you're making a good faith effort, and the department will acknowledge that that is in fact happening at your particular business. So that's how we're going to approach that, through education and outreach type method. However, there's also the requirement to do some potential enforcement as well. And so we're considering doing spot checks at this point in time. Hello? Yeah, we're considering doing spot checks at this time. However, we have not begun to do that. The spot checks would be in a kind of mode where we would want to do education and outreach to the businesses to make sure they understand what the requirements are, that they have a plan in place to put this rule into effect and implement it in their business, and that they're trying to do that. They're working with customers to give them alternatives if they have some type of medical condition, that they provide other type of service to that customer, either through online shopping or doing shopping for them, or curbside delivery, or different methods where they might be able to assist a customer if they absolutely can't wear a mask. So we'd be looking for creative ways for the business to develop in their plan how they're gonna work with those customers. And then for those that absolutely won't comply, they don't have a medical condition and won't comply, then you would treat those just as any other customer that you wouldn't want in your business, and you would maybe ask them to leave, or if you had to, you might call the police department or something like that. I think that's quite a stretch at this point. We're not imagining that would happen, but it is a possibility, I suppose. I mean, something you might have to consider, but we want you to just try to comply with the rule, do everything you can to comply with the rule. It is a governor's order. It is the state law now. And as I said, Labor and Industries is tasked with doing some outreach, of course, education, and in some cases probably enforcement, although that's the last thing we want to have to do. So I think this governor order is going to be provided to you today, and if you'd like to ask questions later on about it, I'd be glad to answer any questions you have. There's been quite an ongoing discussion about masks, as you probably know, and our department has been a part of that, along with the state health department, to try to help businesses and employees to understand what the requirements are. So with that, Tammy, I'll throw it back to you.
Great, Brian, thanks. So a few things before we open it up to the members that I wanted to just somewhat clarify. So when I was working with the governor's office, we did talk to him about law enforcement. And what we have found is that they just will not come out. They don't have time, and they will not come out on any mask violation or face covering. So we've kind of been left on our own. And when we talked to the governor's office, we expressed concerns for the safety of our employees. And I think that's really where the members today will probably have questions is, if we start asking people to leave, that can get dangerous sometimes. We've had some incidents early on with this, and so we want to make sure we're doing everything we can to protect employees and customers, but also keep the situation from becoming volatile or aggressive. So one of the things that we've done is I worked with the governor's office, and this morning they reviewed a poster that I developed, which mainly just says, masks are required. If you cannot wear a mask for medical reasons, then we ask that you respect a 6-foot distancing. So they said, absolutely, that's good. But I wanted to kind of alert you to the fact that, we've had some discussions, and the police just absolutely will not take time out of their day to help us with this. So anyway, so with that, I do want to open the lines up and allow you an opportunity to ask Brian some questions as we, gear up here, and his team is going to be out educating and kind of checking for enforcement issues. What kind of questions do we have?
Tammy, can you hear me?
Yes, I can.
So you're basically saying law enforcement won't enforce this state law, yet we are supposed to, aside from asking them to leave if they don't want to leave, or if they create an issue and we can't call law enforcement, what are we supposed to do? I mean, that's
Well, and I'm not saying all of them are refusing. It's just what we have seen as a trend in areas where our members have tried to get support of law enforcement on the mask issue. It's just not a priority. So it is a challenge. And I think you have to treat it like any other hostile customer situation.
Tammy, this is Kevin. Am I unmuted?
Yes. Hi, Kevin.
So I just, a point of clarification. So what we're doing is we're asking customers that don't have masks if they would like a mask. We provide that to them. And am I to understand that if they say, I can't wear a mask, that we have to tell them to leave the store? I thought that at that point, that's what we needed to do, is provide them with an alternative. And if they have a medical condition, they can just shop.
That was my understanding as well. Brian, what guidance have you been given on that?
Well, some of the guidance that I had was just ideas around what other ways you might be able to help that customer. Maybe curbside pickup, maybe delivery of groceries if you have that type of service. If you can provide 6-foot distance, maybe that is another way, or maybe alternative hours for those customers that have medical conditions. I know initially some of the stores opened where they had hours for the elderly, early hours or late hours or different things like that, where they provided some different alternatives other than just stop. And so there might be ways to create that for people that do have conditions where they can't wear masks.
Thanks, Brian. Kevin, did that answer your question?
Yeah, I think those are some good alternatives. I guess what I'm asking is, if somebody has a medical condition and don't want to wear a mask, do we have to have them leave the store?
No,
my understanding is no, right?
I think the answer is no, you don't have to do that. I think I'd like to see in your plan, of course, as a business opening during the phase 2, you're supposed to have a plan, and the plan to address that type of situation and what you're going to try to do about that. What are your alternative things you might be able to do for a customer in that situation, rather than if everybody comes in and says we have a medical condition, how are you going to approach that, and what's your plan for your business say about that?
Okay.
So to clarify just a little bit more, then, if you don't have a curbside assistance program or online, then another valid alternative is to just ask that person to social distance and stay 6 feet away from others. Is that correct?
I think that's one of the options that can be offered. I'm not sure that that's the best option. Some of the other options may be more protective. Depends on how many people maybe you have in the store that are wearing masks in that situation. So I think it's probably best for the business to lay out some scenarios like that, where you had, okay, our first option would be to possibly have, if we had a lot of people with medical conditions using our store, maybe you have special hours for those in the morning or something like that, or maybe you have curbside pickup for those folks. If you have a list, you can do it that way, and then maybe 6-foot distancing is another option, but the first option you go to every time. So I think in your plan you want to try to address how you're going to handle those situations. As a department, we're probably going to look for what's in your plan, what are you trying to do, is it effective? And, once you start doing whatever method you choose, you can kind of monitor that and determine how well it's working.
Great, thank you. So when you refer to the plan, you're referring to the phase 3 plan that the governor has in his plan.
Every business opening in phase 2 is supposed to have a written procedure or plan for their business. And it's supposed to actually have a written plan, and you're supposed to educate your staff on that plan, and you're supposed to make sure they're aware of what the order calls for, and it's specific to that particular store.
Right. Okay. Perfect. Yeah, and we have provided that in the past, so everyone should have that.
Okay.
Yeah.
Additional questions?
Hey, Tammy, this is Jeff Phillips. I had to join a little bit late because I just got off another conference call. But Brian, who are you with?
I'm with the Department of Labor and Industries. I'm a Safety and Health Consultation Program Manager in Tacoma. We cover Pierce County, Kitsap, Jefferson, and Clown counties, and we have regional managers in other regions of the state as well.
Yeah. So I guess I want to maybe ask another clarifying question. I was under the impression, and I think all the information that we received, including from our local health officer here in Spokane, was that if somebody had a medical condition, they were not required to have a mask while in the store, nor were we required to document them or provide anything additional. If they said that they had a medical condition, they were supposed to be allowed into the store. I'm not aware of anything that we have to do outside of just our normal practice with regard to somebody who claims a medical condition. Am I wrong about that?
No, I think you're mostly right about that. I think one of the things that the department is looking for, though, is a good plan from the store about how to approach this issue and what other alternatives might be available other than just letting people come in that have medical conditions, because you might end up with a lot of people in the store not wearing masks in that situation. And then how effective is that plan addressing that particular problem? So I think you're mostly right about it, but I don't know that it's exactly that simple either. It's one of the things to just say, oh, they have a medical condition, come on in. And I think that the intent is to make it a little more restrictive and safer for those people that have medical conditions, have your employees that are working at the store, other shoppers. And so I think the hope is that businesses will look at other alternatives rather than just let people pass. I know they don't want to ask people about their condition. You don't want to get into what their medical conditions are and any of that kind of thing. There's an opportunity to help those people if you offer a mask. If they're not wearing a mask, if you offer a mask and they say they have a medical condition, ask them if you can help them in any way to possibly pick up their items for them. Are there other hours you can open your store to people that have those kind of conditions? And so I think you're right about it, but I think there's also in your business plan or your safety plan for COVID-19, what other options might you do as well?
Thanks.
This is Kevin.
Brian, so Wendy has had her hand up. So Wendy, do you want to go next? Can we unmute her? Or she's self-muted.
She should be unmuted. Oh, now she is.
Hi, thank you. Can I get Dasha's opinion on face shields, both worn by customers and employees,
Yeah, face shields.
instead of cloth masks?
Yeah, face shields are taking the place of eye protection, and they do not take the place of masks. And so that's kind of the bottom line on that. They can be helpful, but they don't take the place of wearing a mask.
What if someone is behind a plexiglass shield and wearing a face shield? Then does it take the place of a cloth mask?
No, it doesn't. It never does.
Oh, okay. I was, not that we're doing that, but I was at the Department of Licensing today, and the guy was wearing a face shield and was behind a plexiglass shield, and our staff are lobbying for face shields. So I was hoping for some reprieve in that.
Yeah, in Washington State, that has not been approved at this point.
Okay.
So, Kevin Weatherall, I know you've been trying to talk. You'll probably want to speak up because when you were speaking before, it was very difficult to hear you.
Okay, I don't know where my microphone is. We aren't allowing anybody in without a mask. We put up on near our sign that let customers know that there's a law in effect. We put up our accommodations, and we direct those who say they have a medical condition to the ways that we can accommodate them, which include our curbside pickup, online shopping, wearing a loosely wrapped scarf, or wearing a face shield in the case that you can't, we've had deaf people, we've had one person claim to be deaf. And there's nothing that says that you have to accommodate them right at that moment. You just have to inform them that there are those accommodations available. We've had a surprising amount of 22 to 27-year-old males come up and say they have medical conditions when we approach them about masks. And this has put a stop to that. So from our approach, it hasn't been that hard. We've had a few people that, you know, aren't happy about it, but we're being professional, giving good service, and explaining to them that the accommodations we have available for them in the case they have a medical issue where they can't wear a mask. And we think after a week or so, those people will either accept the accommodations or go elsewhere. But we won't have a bunch of people tromping up to the store upset about having to wear, being approached about a mask and then saying they have a medical condition to bypass it.
Thanks, Kevin. That's great information. Yeah, I think a lot are, you know, trying to do what they can in their area. And I do know from our call last week that we've seen an increase in mask usage. So that's great news. It's just those few that make it difficult for us and cause problems for our employees. Brody, you've had your hand up too. Do you want to jump in?
Yeah, Tammy, you know, the C-store industry, it's a different ball game for us in the fact that there's a lot of times that I have single coverage stores. And obviously the number one priority has been keeping our employees feeling safe. And the interaction that we have with the customer, you know, typically is 3 minutes or less. They're in and out. And this thing has exploded to where I mean, I'm dealing with calls daily from customers that are upset one way or the other. And it's getting to where it's really tough on our employees. They're trying to get people to come to work right now. You know, all of this has been tough. They feel like this is one more thing that they're just getting brutally beat by customers daily because we're doing a great job. We have signs on the doors. We've done the stickers across the floor for our social distancing. We've done everything very proactively to know that we were headed this direction. And my gosh, after Friday's announcement or Thursday evening, the public has gone crazy on us, and it is. Our long-term concern is how do we deal with this without one, losing 20% of our business, or two, having more employees walk out on us because they're not comfortable dealing with it.
Yeah, I can see that concern. Brian, that is something, you know, for our convenience stores, they have some unique challenges, you know, with one employee in the store. They get a lot of, you know, aggressive customers that are going to give them problems. I know we've got some guidance here, but I do think that's something that we have a concern with. And I don't know if you guys have talked about this much or not.
Well, we have talked about it. We don't in trying to make things healthier in the store. We don't want to create physical hazards from people that are going to get violent. And so it's definitely something that we have talked about. It's definitely something we do not want to have employees aggressively go after people that aren't wearing masks. We don't want them to get in and start ordering people to leave. So I think to politely ask people to wear masks, to treat people with respect, and politely to obey the rule. I think, you know, there's going to be probably people that are angry, and that probably will happen. I don't really have that's why I talked a little bit in the beginning about law enforcement. I don't know what stores are doing when they have shoplifting and have violent acts in their stores, but I think it could be this a similar kind of situation. What is the plan for that kind of scenario?
So, Brian, this is Brody again. So to your point on the law enforcement, we're having challenges right now with getting them to respond to what they normally would, which would be, you know, shoplifting, vagrancy outside of our stores that are causing issues. They won't respond to it right now. And a lot of that has to do with, you know, a lot of the protests that have been going on. But so that escalates it even worse for us. But I appreciate your response on the fact that not wanting to put our employees at risk, because that's the bottom line. What I've been instructing them every day is you know, if you tell a customer, kindly ask them to kindly put a mask on, and they get confrontational, please just drop it. Don't force them out of the store. Take care of them politely and get them on their way.
Yeah.
And we just don't want to be fined for doing that.
Well, I think if you have that in your plan, that everybody knows that is your plan. That's how you're gonna deal with those specific individuals or those few cases that come up like that. I think you're going to be okay. As far as our department, you can show that you have a plan, and that everybody's trained on that. That's how you're addressing that, and I don't think that's going to be a problem for you.
All right, thank you.
Yeah.
Additional questions?
We do have some questions in the question box, if no one else has anything right now.
Hey, this is Jeff Phillips. Just maybe another couple of things here. So, you know, I think one of the things that has been very, very frustrating for business owners, and I'm not just talking about the grocery industry, but I sit on our Chamber of Commerce board and I hear from small business owners across our community, is that it seems like we get a plan, and then the plan changes and the requirements change, and then they change again, and then they change again. And it's becoming so frustrating for our business owners to manage through these processes. And we're telling our employees one thing today and something else tomorrow and something entirely different the next day. Somewhere along the line, the level of detail that is coming from the governor's office has been very lacking. This is my personal opinion, and maybe others share that, but we have got to have better information coming from the governor's office around the specific details of these things. We can't just make these global statements about what we're doing with masks and enforcement and all those kinds of things without real detail around it, and then getting that real detail out to the public, because everybody out in the public interprets it differently too.
Yeah, excellent point.
Yeah, real good point. I think that's the situation we've all seen, we're all part of, and it has been very difficult.
Yeah, so definitely, I think, Brian, part of what, you know, we're asking is we're hoping that DOSH will be on a real educational level on this. You know, if an inspector comes out and they see, you know, that the employers are trying, you know, but we've got all these challenges, these unique things going on, that, you know, maybe we can have more education instead of penalties, because I don't think we're talking about any employers here that are trying to ignore this. We're trying to do the right thing, and so
Right.
that's
So
what our hope is.
we're having the types of complaints that are coming in from the general public about masks not being worn and those kind of things are going to the emergency operations center, and then phone calls are being made to the business and letters are being sent out. It's different than an employee complaint. An employee safety complaint, those are being handled directly by our normal team within labor industries. And so when we see an employee complaint, it's a type of health complaint.
The guy who has a tattoo parlor.
Supervisors are still contacting or visiting the work site.
Thank you for that. So Rebecca, do you want to go through the questions that we have in the question box?
Sure. So the first one is, if we have an office setting where people can remain over 10 feet apart, but there are no partitions, is this legal without a mask?
No, currently the rule says to wear a mask at all times in the building. I don't think there's that discretion. The barriers are part of the best management practice and the rule, but this particular new order that starts today requires masks all the time indoors and then in a public place. You can't keep in a public exterior outside when you don't can't keep 6 feet outside and all the time inside. If you're not alone.
Okay, next question is, if we have a customer who's not wearing a mask because of medical conditions, what do we tell a customer who questions why they need a mask but the other person doesn't?
Well, that's kind of the difficulty of having people in the business that say they have them, you're allowing them in. I mean, it creates that kind of question. And what do you tell them? And you have to tell them, well, that person has a medical condition, maybe. And you could, we have accommodations for people that can't wear masks, but the rule is that everyone is supposed to wear them. We're making special accommodations for those that can't. But the gentleman that talked about with the different types of scenarios that they offer and accommodations they offer for their customers, and they don't let anyone in that doesn't wear them, that is the best scenario, and then you avoid that problem.
Another one is, given the new order, has anything shifted in terms of guidance for how employers should handle employees who medically cannot wear masks?
No, that stays the same. So employees have to wear masks unless they have a accommodation, and then the accommodation has to be in a way that follows this rule. And so it doesn't leave a lot of options. Working alone, teleworking, there's not a lot of great options for those folks right now as far as how they're going to continue under these kind of situations, because there's less and less options available if they can't wear a mask. So it's hard for the employer, it's hard for that employee right now because the requirements are pretty strict.
So Brian, are you saying that those employees must be terminated then?
No, I think, there's options as far as furlough. There's possibly ways to find alternative work. They're maybe working from home and teleworking. If those options aren't available, maybe furlough is a possibility.
So Brian, guidance that we received earlier on this because of its grocery, we don't really have work from home. The governor's office, and when I talked to Ann, if we could provide them with a face shield, if they were able to wear a face shield and they were able to maintain 6-foot social distancing, we could continue to allow them to work. So that was the guidance that we had received before, because they didn't want us to start having to lay off a lot of people when we were already struggling to keep employees. So yeah, I definitely need to make sure I follow up if that guidance has changed.
Yeah, that would be a good idea. I have not heard that. And we have weekly calls with our assistant director, who is Ann Soiza, and she has not, in the weekly calls that she does to her management group, I have not heard that.
Okay.
If she told you that, then I would follow up directly with her.
Yeah, I'll give Ann a call and just talk to her about that, because we want to make sure that we've got consistency and that we're all, working from the same page here.
Yes, and if you find out something different, could you let me know too?
Yeah, definitely. I most definitely will.
Because we do have a big state, we do have a lot of employees, and sometimes there's information that is given out. We don't want to have inconsistencies, and I'd like to make sure that I'm not saying something that's incorrect here.
Yeah, no, I appreciate that, and I for sure want to make sure that DOSH enforcement has the same guidance that we get. So yeah, I will certainly follow up with you on that.
Thank you.
What about masks in restaurants? You said masks in all indoor spaces.
Yeah, so masks in restaurants, you know what, I'm going to have to get back to you on that one. I know that masks going into the restaurant would be required, the way I understand it, but then if you go to, say, outside seating where it's more than 6 feet, outside type venue, then you can take the mask off. That's my current understanding. So
with the tasting room. So we're operating restaurant spaces and we're requiring masks while waiting for your table. And then if you are up from your table. But obviously while you're seated and eating, you're not required to wear a mask.
Okay, so when you're seated and eating and you're 6 foot spacing between tables at least, and is that the current? So I'd have to actually double check that. That's probably right.
Right, because the tables are already spaced, and then you're led by the hostess who is masked to your seat, and you are allowed to take off your mask during the time you are physically in the chair. You're not allowed to wander the restaurant. The bar is closed. And if you get up to use the restroom, then you put your mask on. And we have disposables there to give away for anyone who does not bring a mask with them.
Yeah, that sounds right to me. Tammy, can you double check with Ann when you do check on the other question? I mean, one of the things that's happened here is we have phase 1, phase 2, phase 3, and all the different counties are in different phases. And so the different phases require different things for different types of businesses. So I have to apologize if I'm not up on every type of business today, but it sounds like, the business owners here know what their requirements are. So that's a good thing.
I'll follow up on that, Brian. I'll let you know. Thank you.
Another question. So am I hearing they recommend disallowing any customer in the building who is not wearing a mask?
Well, the medical accommodation was one exemption from that. And then it's a matter of how you approach that. What alternatives you're going to allow for that customer. Some of the things we talked about earlier here.
Has Governor Inslee's office posted the written order on statewide business enforcement of face masks? The guidance references it, but we have not been able to locate, and the version on the Washington State website is different than the one shown here.
Yes, he has, and I will get that link connected. They just got it done today, you know, as usual, last minute. So they had sent the guidance sent to all of you the day before, and we do have a final now. So I'll make sure that's linked on the website for you. So I think that was the last question in the question box. Anyone else have any questions for Brian while he's still here for us?
Can you hear me? This is Brent Olson.
Yeah, hi Brent.
And I'm with Employer Resources Northwest. I was just going to make a comment. I was looking at the order through the governor, and one of the things that it lists is individuals may remove their face coverings when in public settings under the following circumstances: while seated at a restaurant or other establishment that offers food or beverage service, while they are eating or drinking, provided that they are able to maintain a distance of at least 6 feet from guests seated at other tables. So it sounds like the previous comment about the tasting room is pretty on point there. So
Great.
Thank you. Anyone else?
If a building is private, not a public access building, we want to confirm the rules are the same. Just want to be black and white. So is it public space or does it include private space?
So are we talking about a public or private space that is used for public gatherings? Or
I think he's talking about his office building.
and public doesn't come there?
So let's make that assumption for right this minute. If you have, a private office space where you do not allow the public in, do you have the same mandate?
No, then that would not be required there because there's no one else there. If he has employees there, and everybody has to wear masks. But if the person is there in their own establishment, sole proprietor, by themselves in their building, no, they wouldn't have to wear masks.
One more here. Proclamation 20.46.1 does not allow high-risk workers to be permanently replaced. Does this apply to those who can't wear a mask?
But I think the order is still in place where you can't fire employees for having medical conditions that prevent them from wearing a mask. I think that is still part of the order.
Yeah, and that's part of the clarification that I'm going to get from Ann again, which is we can make other accommodations for those employees so we can keep them working. And I'll need to make sure I verify that with her and that Brian and the team has the same direction on that. So there's no confusion.
Tammy, could you check that? Because I think there is an expiration of that. I think it's 6 months. If that person can't come back to work for 6 months, that we're being asked to carry that person on our insurance plan until 6 month period of time, and after that they can be terminated if they're not able to come back.
I will definitely get all of that clarified again for all of us.
That would be great, Tammy. This is Brenna. I think I just got confused about making sure that employees that have a medical exemption for wearing masks still have an employment and where to assign them in the store. And I'm not sure if this new order actually changed any of that. So I'll look forward to that. Thank you.
Yeah, definitely, because I had assumed it had not changed it. We definitely want to make sure that I've got a direction for you, and the DOSH team also has the same direction. Okay, anything else before we wrap up today? with Brian? Well, Brian, I want to thank you so much for your time today. I really appreciate your perspective and time to answer questions for the members here. I'll definitely follow up with you on the few things that we need to get ready on. And yeah, look forward to it. And, please keep in touch with me if you start seeing some trends within groceries or convenience stores. I'd really love to hear about that, whether they're a member or not. I want to keep our team informed, our members informed on what's happening.
Okay, thank you, Tammy, for having me. And there's some great questions today, and hopefully I could answer most of them. And sounds like we'll follow up on some of those that I couldn't. So I really appreciate the opportunity here, and have a great day, everybody. Thank you.
All right, you as well. Thank you. Okay, thanks. Does anybody have any questions for me or anything else they would like to make sure I get further clarification on?
Hey, Tammy, I think we need some clarification around this face shield thing, because not long ago we were told that face shields were okay, and we have a number of our employees who are wearing face shields. If we end up having to go backward on that, we are going to have a lot more people out on medical leave, where we are covering their insurance costs and they're at home collecting unemployment.
No, I agree. And I really think this is one of those situations. That's glad to have Brian on the phone today, to have an actual DOSH inspector on the phone, because I'm dealing with the high level people. I'm dealing with Ann Soiza, who's the director. I'm dealing with the governor's office, and they give us this guidance, but it's not getting to the people who are issuing the citations. So I think this is a matter of me calling Ann and just saying, this is the guidance you gave me. I need to make sure that you're letting your DOSH enforcement people know that this is okay, because that was clear from the governor's office and from LNI. And so I just want to make sure they're getting that information to the people who are actually enforcing them.
Yeah, I do think we need to push back on a number of the things he talked about today.
Yeah, I definitely agree, because that's the whole reason that this mandate was written the way it was, because we had a lot of input with the governor's office and with I to make sure that we were not the enforcers of this.
That would be very appreciated, Tammy, because to be quite honest, right now I'm more confused with what he said than I was before. And to be quite honest, half of the stuff he mentioned, I went, what the heck? That's not what we're told, or that's not what we're doing.
No, and I already got full clearance from my poster that just says, you must wear a mask unless you have a medical condition, then you need to maintain 6 foot social distancing. So that is all we are required to do, is to advise people that, you must wear a mask unless you have a medical condition. You just need to stay away from and protect them. So that's the guidance that we were given and approved by the governor's office. We just need to make sure, and I'm actually, like I say, I'm glad Brian was on the phone, because I want to make sure we're getting this information to the people who are out there issuing these citations. It doesn't do any good if I've got LNI's main person and the governor's office telling us one thing, but then we've got somebody enforcing something different.
Exactly. And what I wanted to ask him, but I was like, I don't want to be, how much are the citations? Are they, I'm like, do I just do what I'm doing and pay a citation and just go over it?
Well, they can be $10,000, because everything that ties to the governor's whole Stay Safe mandate has a penalty of $10,000. And the reason they did that is because they originally were going after who were staying open when they weren't supposed to. But now we have this dollar amount sitting there. I think it's $9,600 to be exact, that is a serious penalty. And so
That is a lot of money
with that. So yeah, so clarification is critical, and I will, as soon as we're done, I'm actually going to reach out to Anne and make sure that she talks to her team and that we have a very clear direction on this.
Mm-hmm.
Thank you so much.
Definitely. Any other questions? So that mask poster, it's a very simple one, but it is posted on our website. It's new this week. It's down toward the bottom. If you want to put those on your doors or somewhere out there, you know, feel free. I know I've talked to different people. We had one store, a smaller store, where if people come in and they don't have a mask on and they say they have a medical condition, they're giving them a green card that they have to carry around. And the card just mainly says, maintain 6-foot social distancing. But then people know that they're in there with a medical condition and can't wear a mask. So everybody's coming up with some creative ideas. When you talked about the safety, actually that phase 3 safety view that we talked about before, and I filled one out for our office. In fact, it's just your, and then once you've got that done, you need to make sure you share it with your team, and then it needs to become part of your safety manual. So that's also on the website, and it's just that phase 3 safety plan. Any other questions before we wrap up today? I hate to leave you with more confusion. Our goal is to give you clarity.
I know. It's not your fault though.
No, but what's really weird is DOSH is tasked with protecting employees, right? And this is this weird dichotomy between trying to protect our customers and our employees, and the interests seem kind of competing.
It's very true, and that's why early on I was like, okay, so who's enforcing all of this? Because the original mandate was the police department. They were the enforcers because it was, you know, statewide, and it was you had to wear a mask everywhere. Well, then they changed it, and so Yakima County was, you know, first where they said, okay, in Yakima County the stores have to, you know, help enforce this. So in Yakima, then they said, oh, well, I is going to regulate that and make sure the stores are and all these other, you know, businesses are doing their job. So that's kind of how it tied together, which is really odd because again, yeah, it's not really an employee issue, but in a way, I guess it is. So yeah, it's odd, very much, and the penalty is absurd, and that's why I stressed again that this needs to be education and not citation, because I don't think any of us are intentionally trying to harm anyone.
No, but the messaging around the cloth masks is that they don't protect the wearer. They protect the wearer if 2 people are wearing them. And so that's where it gets weird, is we're not having our employees wear a cloth mask to protect themselves.
Right.
And that's what L&I is supposed to regulate, is how well we protect our own employees.
Exactly. And so the way they're tying this in is they're saying that if customers are coming in without a mask, that they're putting your employees at risk, and then it's a safety hazard. It's a twist, but that's how they're getting this tied together.
It is a safety hazard. Employees are concerned about going home and taking an illness home.
I'm sorry, you kind of cut out there.
Just saying it is a safety hazard, and employees are worried about taking an illness home and getting it.
Mm-hmm. Yeah.
That's why I'm taking a strong stance.
Yeah.
I care more about employee safety than I care about someone being uncomfortable wearing a mask for 20 minutes.
Well, and like I say, I mean, you know, everybody has seen an increase in mask usage. I think it's different though based on where you are. And I know that there's some communities that are really struggling with this. And again, convenience stores, I totally understand that. People are running in there real quick and not giving it two thoughts, and making it really hard on that person that's behind the counter.
I own a convenience store too.
So hopefully some education. We've used the office and others to start a campaign to educate people, because that's where this needs to start. It shouldn't be us that's trying to educate society on. It needs to be the governor's office. Anything else for the good of the order? So if not, what I'll do is I'm going to follow up on our questions that we had, and I will try to get answers as soon as possible. And then I will send those out to everyone, not just the ones on the call, but everyone. We'll make sure that, again, if we were correct in the first place, that Anne reaches out to her DOSH inspector and make sure they're educated on this as well. So we're not having to be in an awkward situation on these things. So with that, I want to thank all of you today for your time, and please let me know if there's anything I can do to help or anything else that comes up. Any ideas that you have, I really like hearing about those, because it's great to be able to share it with others, because I think that's why we've been so successful, is because we all share what we're doing and how it's working. So with that, thank you all very much, and I hope you have a really great day.
Thank you. Take care.
Thank you, Tammy. You too.
Thank you.